Hi, I'm Dr. Sue Windmill, a pediatric audiologist with University of Mississippi Healthcare. In this segment of UMHC Take 2, we're going to take a look at newborn hearing tests. A newborn hearing evaluation includes several tests that measure the function of the ear and the auditory system. The auditory brainstem response, or ABR, is one of these tests. This test allows us to determine the type, degree, and configuration of hearing loss in babies as young as 1 day old. You may be surprised to know that hearing loss is the most common congenital anomaly found in newborns, with approximately 4 in 1,000 infants having significant permanent hearing loss. Many babies with hearing loss have no apparent risk factors or other indications prior to birth that impairment may exist. 90 to 95% of deaf children are born to hearing parents. Typically, these families want their children to be able to listen and talk as they do. Early identification and intervention are the most important factors in the success of a child with hearing loss, so the ABR is invaluable to infants and their families. All newborns in Mississippi are screened for hearing loss prior to leaving the hospital and are referred for an evaluation to include ABR if necessary. In addition, infants who have spent time in the neonatal intensive care unit or have other known risk factors for hearing loss are referred for ABR testing. To complete the ABR, the infant must be asleep. Once asleep, tiny electrodes are placed on the baby's forehead and earlobes, and small, soft earphones are placed in the child's outer ear canals. The earphones deliver sound to the ear, which creates auditory brain waves that are measured on a computer through the electrodes. Each ear is tested separately. Auditory pathways and brainstem function are evaluated, and hearing thresholds are determined while the baby sleeps soundly. The evaluation is safe, painless, and can be completed in about an hour if the baby sleeps well. For babies under 6 months old, an ABR is performed during their natural sleep. To perform the procedure, we work with parents to determine an appointment time at the Batson Audiology Clinic that coordinates with the infant's regular sleep cycle. In some cases, when the ABR can't be accomplished during natural sleep, an alternative is to perform the evaluation while the child is sedated. The ABR offers an in-depth assessment so that the most appropriate interventions can be initiated immediately for each child with hearing loss. Common audiologic interventions include hearing aids or cochlear implants. Without ABR and the appropriate interventions, the hearing impaired child will have speech and language delay, behavioral and social issues, and an inability to reach his or her academic potential. Thanks for watching this segment of UMHC Take 2. I'm Dr. Sue Windmill. You can learn more about medical procedures on UMHC Take 2 at umhc.com.